Good day and welcome to Ease and Different Radiology. I am Dr. Osama Ibrahim. Today, this video will help to expand your knowledge about the diagnosing modalities for the brain disease. Actually, this is a tips and hints number 18. So let's start our presentation. First of all, I wanted to give you some general notes about the brain vascularity. And these notes including that the human brain gobbles up to 10 times more energy than the rest of the body. This is meaning that the brain eating through 20% of our fuel intake on average when we are resting. Even in comatose patients who are said to be brain dead or brain death, only 2 to 3 times less energy is consumed by the brain. Actually, this is CT angiogram for the normal brain, which is showing the internal carotid artery and its bifurcations to anterior cerebral artery, middle cerebral artery. Middle cerebral artery have 4 components, the M1, M2, M3, and M4, which representing cortical branches of the middle cerebral artery. Also the basilar artery or posterior circulations, which also this basilar artery bifurcates to give to posterior cerebral artery, right and left, to forming the circle of wheels. This is the normal circulations of the brain. What is the definition of the brain death? Brain death is defined as an irreversible terminations of functions of the entire brain, including the brainstem. So from its definitions, this is considered as a clinical state determinations, and also according to the American Society of Neurology, which also deciding these definitions as the definition of the brain death by clinical way. So what is the role of the radiology in the diagnosing of the brain death? The role of the radiology or any imaging modality is only helpful for diagnosing or confirming the clinical situations of the brain death. American Association of Neurology has defined the brain death with 3 cardinal criteria. First one, cessations of the functions of the brain, including brainstem, as we mentioned it in the definition. Coma or unresponsiveness, apnea. This is the 3 cardinal criteria according to the American Association of Neurology to diagnosing a brain death. All of them are clinically as you show them. Again, the cerebral blood flow imaging techniques, which has ancillary role in the diagnosis of the brain death, is considered four imaging modalities. The first one is the DSA, which or digital subtraction angiography. Second one is the NM or nuclear medicine. Third one is CTA or CT angiography, and the unenhanced CT. This is the main 4 ancillary findings which are be depended on it according to the Society of Neurology, American Association of Neurology. So the DSA is considered as a gold standard technique or test for diagnosing or confirming the clinical status of the brain death. And this can be occurred by absence of filling of the 4 arteries as their course become intracranially. And the meaning of 4 arteries here is the main 4 arteries intracranially continuation of the brain: right common carotid, right internal carotid, left internal carotid, right vertebral artery, and left vertebral artery. So the 4 arteries is the vertebral and internal carotid arteries in both sides. And the nuclear medicine is considered also another gold standard technique for diagnosing of the brain disease, and this can be occurred through non-tracer uptake of the brain tissue, and which appearing inside the skull as a hollow skull or empty bulb sign. We'll see images for all these techniques in my presentation today. The third one, which also considers a good technique for confirming diagnosing of the brain disease, is CTA, and CTA is considered, according to the American Association of Neurology, is a valuable test. Valuable test by diagnosing the lack of intracranial contrast opacifications can be assessed by the point scales. There are three types of point scales: 4, 7, and 10 point scales, according to the schools of diagnosing of the brain disease. 10 is more accurate, 4 is sufficient and considered as a variable test for confirming diagnosing of the brain disease. In the end of my presentations, I will discriminate these 4, 7, 10 point scales. How can you diagnosing these vessels or counting the vessels according to the scale? The last test, which is also considered as an ancillary rule in diagnosing of the brain disease according to American Association of Neurology, is unenhanced CT. Unenhanced CT is considered a not very reliable test, and the finding which can be got through this test is the diffuse loss of gray-white matter differentiation. Let us now see these tests and these techniques imaging finding of the brain disease in some cases. So let's practice now. This is the first case from my daily work cases of the CT brain without contrast in the upper cuts and in the posterior fossa cuts. So this is an enhanced CT examination which is showing the brain gray-white matter cannot be differentiated from each other, even in the supratentorial regions or in the tentorial and infratentorial region. So this is which can be described as a diffuse loss of the gray-white matter differentiation. You can also see the falx cerebri, which appearing prominent and apparently hyperdense comparing with the low density of the brain, which have diffuse ischemic changes. Also the tentorium, which appeared also hyper dense compared with these low density cerebral and cerebellar hemispheres, as well as the regions of the quadrigeminal cistern is markedly effaced due to diffuse edema, and all these findings can be mentioned as an apparent subarachnoid hemorrhage. There are no subarachnoid hemorrhages. This is only appeared due to relatively low density of the brain tissue. Anyway, in unenhanced CT brains, we can differentiate these findings: diffuse loss of gray-white matter differentiation, and this finding is enough to diagnosing the brain disease. However, the CT, according to the American Associations of Neurology, considered not a very reliable test. However, it can be helping in the suggesting diagnosing, and you can advise further examinations with CT angiography, for example. This is another two tests for the same patient. The first one, this one is the CT brain unenhanced without contrast, which is showing loss of gray-white matter differentiations, and also the ventricles appeared markedly effaced, and there are no any subcortical cell size can be differentiated. So all these findings can be mentioned as a diffuse loss of gray-white matter differentiation. As we know, this is not a very reliable test. However, it is suggesting there are some probability of the brain disease. That test is nuclear medicine, which is called technetium 99M HMBO or HMBO. And this test or these tracers should be taken by the brain tissue and also in early stages by the vascularity, because it can be taken immediately after 30 minutes and after 2 hours, and compare the image. The image here in all phases showing slightly opacification of the common carotid vessels and no opacification of the internal carotid artery at all, and also there are no opacification of the brain tissue. And this finding is this finding which representing no blood flow. There is no accumulations of tracers in the brain, and this can be called as a hollow skull sign or empty pulp sign. Empty pulp signs because it looks like the skull looks like a pulp with empty due to no opacification of the brain tissue, and this is a gold standard technique, remember, and can be highly diagnostic of the brain death rather than not very reliable test of the unenhanced CT. This is a CT and the nuclear medicine for the same patient diagnosed as a brain death. The third case is a case of brain death from my daily work cases, which is called CTA or CT angiography, and this is after injections of contrast and imaging of the neck arteries and the brain arteries. We can see the internal carotid artery arising from the arch of the aorta. Sorry, the common carotid artery arising from the arch of the aorta. This is the left common carotid artery, and this is the right common carotid artery. At the bifurcations, you can see the external carotid artery and the internal carotid artery as a proximal or origin segment only. However, the continuations of the internal carotid artery in both sides cannot be seen inside the intracranial. At this lateral view for the same patient, also confirming there are no intracranial opacifications of the intracranial arteries. And this is the CT examinations post-contrast for the same patient, also showing no activity of the contrast inside the brain, which meaning there are no flow inside or intracranial vessels. And lack of intracranial contrast opacifications is a finding in CT angiogram, confirming diagnosing of the brain death. This is another image of the brain death. Also, this is CT angiogram, and CT angiogram showing opacification of the external carotid artery branches only, like scalp vessels. However, the internal intracranial there are no any activity of the opacificated vessels. So there are lack of intracranial contrast opacifications, and this is with presence of continued filling of the extracranial arteries. This is a good sign in CT angiography for diagnosing of the brain death also. And remember that CTA is a valuable test for diagnosing of the brain death according to the American Association of Neurology. CT angiography from my daily work cases for a patient with brain death also, which is showing opacification of the common carotid artery. However, there are no activity inside the brain. And also this image which is showing there are no activity, no opacification of the internal carotid artery at the regions of the sphenoid or parasphenoid region at the cavernous sinus. So this a good sign for opacifications or diagnosing of lack of opacification of intracranial vessel for diagnosing of the brain death. And CT, always remember that is a valuable test for diagnosing of that pathology. This is another examination or another modality for diagnosing of the brain death. Actually, this is an MRA or MR angiography with using of time of flight technique, which meaning there are no contrast given. This is only technique in the MR. Diagnose the brain dead patient. In brain dead patient shows no intracranial flow. Also, by the same way, this is a common carotid artery. The external carotid branches only can be appeared. However, are appeared. However, the internal carotid arteries in both sides cannot be opacified in all images. and preserved extracranial flow on the source image, meaning that finding for diagnosing of the brain death. However, still, MRA has not yet been proven as an ancillary test in assessing of the brain death according to the American Associations of Neurology. So MRA, we don't depend on it like CT, because the MRA need some precautions, like transfer of the patient which is suspected to be in the ICU to the field of imaging, and also the CT angiography have better resolutions for angiography of more than MRE. And this is another examination modality which considers a good standard, which is called DSA, or digital subtraction angiography. And this technique depends on injection of catheter inside the selected vessels which you want to image, and inject contrast and viewing the study with the contrast at the time of injection. This is considered as a gold standard test according to the American Association of Neurology for diagnosing of the brain death. Absence of filling of the four arteries as their course become intracranial is a finding which we can considered to diagnose the brain death. The four arteries here mean the left common carotid artery. So we enter the catheter inside this artery and inject contrast and take the image, and this image is showing only extracranial opacification. There are no intracranial component of the injected vessel. Right coronary artery, this is the injection at that time at the right coronary. Also, there are no opacifications intracranially, only extracranial opacifications of the vessel. Left vertebral artery, changed the catheter and inverted it into the left vertebral artery, which is showing the same finding, absence of filling of intracranial component of the artery. Right vertebral artery, there are no also injected contrast noted at intracranial. So this is the meaning by four arteries. You should be in the four arteries. There are no opacifications intracranially to diagnose the brain death. And this technique needs specific radiologist to do it, and also it is depend on its availability in the center. So, however, it considers a good standard test for diagnosing of the brain death. The middle cerebral artery have four components. This is the internal carotid artery, which this image is, or diagram is an coronal diagram showing the coronal view of the middle cerebral artery arising from the internal carotid artery. This is which after divisions into anterior and middle cerebral artery. The MA1, or the first segment from the middle cerebral artery, is a horizontal segment, and it can be also named as a sphenoidal segment. Then segment 2 is the insular segment, which is appearing by violet color here, which passing through the insula, or at the outer surface of the insula between the lemon insula and the opercular cleft. And at the opercular cleft of the insula, there are the third part of the middle cerebral artery, or M3, which appearing by green color, which passing through the insula, or the fissure, Sylvian fissure, and this is representing M3. Until now, even if these three arteries are opacified, it considered normal. However, this segment is M4, which is a diagnosing segment for the brain death, and M4 is representing as a cortical segment of the middle cerebral artery, and M4 is represented by this orange color, which meaning is the cortical segment. It should be opacified in all imaging techniques of the angiography of the intracranial vessels. If it is not opacified, it considered one sign for the brain death. So the area of interest in the middle cerebral artery, which we depend on it in diagnosing brain death, is the M4 segment. This is the anatomy. So CT angiography, or lack of intracranial contrast opacifications, can be assessed by
the point scales. According to the previous slide of which describes the anatomy, the point scale can be considered. The 4-point scale is depend on M4 segment, as I mentioned before, cortical segments of the middle cerebral artery, and also the intracerebral vein. So M4 segment in both sides, intracerebral vein in both sides. If these 4 vessels is not opacified, so this is which meaning 4-point scale, and diagnosing is brain death. The 7-point scale in another school depend on the 7 vessels not be opacified to diagnosing the brain death, and these 7 vessels are the first 4-point scale plus the anterior cerebral artery in both sides and the great cerebral vein. So anterior cerebral artery, 2 anterior cerebral artery, and 1 great cerebral vein. This is the 3 more in this 4 plus this 4 to consider 7-point scale. The 10-point scale in the most school or most number in the school is depend on the previous 7 plus 3 vessels, which are posterior cerebral arteries in both sides and the basilar artery. So we can completing the 10-point by this score to be more accurate for diagnosing of the brain death. You can use the 10-point scale for more accurate diagnosing. I think learning this way will help you to make fewer mistake when diagnosing the brain death by according these point scales, according the American Associations of Radiology, of Neurology, sorry. And now I want to finish up my presentation today, or my lesson today, according to the brain death by this slide. And these slides which also showing the opacifications of the internal cerebral artery, anterior cerebral artery proximal segment, and the middle segment of the proximal segment of the middle cerebral artery on both sides. However, this case is CT angiogram for a brain death case, which clinically confirmed as a brain death. So why we diagnosing it as a brain death according to the previous scale? Look at these vessels again. There are contrast opacifications of the bilateral internal carotid artery, this one and that one, which appearing also in these cuts because this is slightly lower cuts. We can see the anterior cerebral artery bifurcation. So it is opacified in both sides. The proximal branches of the bilateral middle and anterior cerebral artery also can be seen. This is the middle cerebral artery opacified, and the anterior cerebral artery, there are 2 anterior cerebral artery also opacified. So until now the study appeared looks like normal. However, there is also some opacification of the only right posterior cerebral artery. The left cerebral artery is not opacified. All these are a positive finding. There are continuation filling of the extracranial arteries. If you look closely to the extracranial vessels here and there, you can find the extracranial vessels which appearing opacified also. And this is also one finding which also need to be accurately diagnose it, because it is helpful to diagnosing the brain death. The main finding in this study is there are none of the 2 images shows opacification of M4 segment or cortical, which is a cortical branch of the middle cerebral artery, which appeared at that region. So if there are no opacifications of the M4 segment, this is a bad sign in the CT angiogram. Distal anterior cerebral artery also cannot be seen, only the proximal segment is appeared. Internal and great cerebral veins, which can be seen at the quadrigeminal cistern, not be seen. So this is enough in the CT angiogram, enough finding to diagnose the brain death. And remember always, the CT angiogram is a valuable test for diagnosing of the brain death, which already clinically confirmed as a brain death, and CT angiogram only as considered as ancillary finding or ancillary test technique, imaging technique to diagnose the brain death or to make confirmations of the brain death. At the end, I hope I provide you with clear knowledge about the brain disease, how to diagnose it, and what is the most important imaging modalities to diagnose it, and the signs of diagnosing light, like empty pulp sign in the nuclear medicine or lack of opacifications of intracranial vessels, and considerable and modalities which is the most reliable diagnosis, valuable and golden standard. Thank you very much for watching, listening, and have a nice day.